Hi, I'm Madison, the plastic injector, and let's go over this result of our Elevate package. The Elevate package is our signature service that includes a few treatment modalities to achieve this result. This patient, as you can see, is young, gorgeous, beautiful spirit. I had a lot of fun treating her, but let's start from the top. First and foremost, what brought her in is that she didn't like her under eye hollows. So the first thing that we do when we look at this patient is we assess the deep fat pads beneath the tear trough itself. This includes the medial SOOF and the lateral SOOF, which are deep fat compartments beneath the tear trough. We supplemented this deep, then we also went in with a superficial injection to allow for that medial face to move forward. This gives support to the tear trough itself, oftentimes not even needing tear trough filler at all. Once we corrected this, we then saw that we did in fact need to go into the tear trough itself. We did this again with a dual plane technique. This means we inject deep and superficial. Notice there's a trend here. Dual plane technique is a really good way to make sure that you're treating different planes of tissue in the way that we naturally are formed. Moving downwards, she didn't like her folds. These are called the nasolabial folds, which is the fold between the nose and the mouth. Again, here we used a dual plane technique. We injected both deep on the piriform aperture on bone, but we also injected more superficially to allow for a soft but natural coating to this area. Next, we treated her masseters, which is that muscle at the back of the jawline, to debulk or soften the appearance of the jawline and allow a little bit more femininity to her profile. Next, we dissolved her migrated filler from her lips. She also didn't like the fullness above her top lip. When we dissolved, you notice how now her lips look a lot more natural and even helps the nasolabial fold itself not to appear so deep. Last but not least, we addressed the chin area by doing a little bit on bone and a little bit of the softening of the chin shadows, again using a dual plane technique. All in all, you can see that this patient just needed a little bit of product to really just give her a more natural result that nobody can really tell that she had anything done. When she came in for follow-up, she said, "I feel like I'm wearing makeup," even though she wasn't. And that's the goal for us. We don't want you to be reliant upon makeup. We want you to feel confident without it. And if we can achieve a natural outcome where you feel more confident in the room, at home, in your workplace, then we've done our job and nobody can tell what you've done.